Morning guys, Andrea here, owner and senior podiatrist at AC Podiatry. Early morning, it's nice and chilly in Adelaide today. Look, today guys I wanted to share with you about neuromas. Having a conversation with the girls yesterday on my drive back from Clare, and we've had 3, 4, 5 neuromas in the last couple of days that the girls are dealing with. And I wanted to get on and think, well, it's obviously quite topical at the moment, and it got me thinking, well, why and what can I do to kind of help you guys? Hi for watching. So what I want to talk about is neuroma essentially gives you burning or tingling across the ball of the foot. So generally speaking, what you'll find is that across this part of the foot here, you'll get burning, tingling. It can run down into the toes. It can be really quite debilitating. It can stop you wearing those wonderful high heels that you like wearing, or doing the activity that you'd really like to do, such as netball or in some of the guys' footy. But it tends to affect ladies more than men. And the primary reason for that is this kind of narrow shoe that kind of really compresses this forefoot. And you have a nerve that sits in between these long bones, and when that gets squashed, that can actually cause a real pain and aggravation. And over time, that nerve can thicken, and that thickening is what we call a neuroma. Now, common misconception is that you need to kind of either have surgery to have the neuroma cut out, or cortisone injections to reduce the swelling and aggravation. And look, both of those do work. But you're effectively treating the symptoms and not the cause. And I figure that, especially because it seems to manifest in a younger cohort of patients, so women in their 20s and 30s specifically, why would we want to do that then? We've got a lot more time to be running around on our feet. So one tip, if you're having that burning and aggravation, is just to get into a shoe that's a little bit wider, okay? Now, it can still be a heel if you like, but you just don't want to get that squash. And so if you can prevent that squashing, you're generally going to feel a little bit easier. And that's without surgery or anything like or cortisone. Now, sometimes a change in shoes is not going to do it, and that's just the reality. And there are plenty of other strategies we can use, things like dry needling or acupuncture. You can use manual therapy or mobilization to kind of free up the joints, or what we call hydrodilation, where you effectively put a little bit of local anaesthetic in the area to kind of spread it apart and settle some of the pain that way. And then, of course, if there's a mechanical cause, we can look at orthoses or something like that. So guys, I hope you've taken something away from this today. It is a really common problem, and something obviously we see more in winter because people wear more closed-in shoes rather than summer, where we tend to wear open shoes and don't get that squashing. Now, if this sounds like you or you know somebody, look, we're running a campaign, a winter warmer campaign, a gap-free assessment for you guys to come into the clinic and get seen, and it's only running for July. So there's no risk to you. If you've got private health insurance, there's no out of pocket. So look, why not come in? If you want, I can, you message the PM, I'll flick you the link through to the landing page where you can fill in your details. And let's get that fixed, because I know how painful it can be, I know how annoying it can be, and look, we just want you fixed. We want you getting back doing those things you love, wearing those pumps or those heels that you want to wear, being able to boogie and dance the night away. So look, this is Andrea again. Hope you have a great Friday, hope you have a great weekend, and I look forward to catching you soon. Okay, bye.